in my experience is that you got to have a love affair with people. It's like, it's ministry. Whether you're Catholic or not, it doesn't matter. It's caring for people. I came to work for 3 years, and I've been here all these years. It's something, and I don't know how to explain this. It's something about the atmosphere. I can't. Some people don't know what I mean, but it makes me stay. I get here, it's like the passion. I'm trying to find out how we can help people, and that's what drives me. My name is Margaret Boddie, and I've been with CCS since November the 4th, 2004, which is past 18 years now. And I'm director of the African American Elders Program. It's an older Americans federal program. Mm-hmm. And this program I started myself as I worked with the city of Seattle. Wrote a plan, the city council approved it, funded it, and it's going on right now. So this is probably the 18 years here and 4 years before I came here. I was a human services program supervisor at the time. I also served on the allocations committee, which the city of Seattle is called the Area Agency on Aging, which is federal money comes there, and they fund all aging programs in King County. Mm-hmm. So I sat on that committee as a staffer, and I saw no plans or ideas to serve African American elders. There were plans to serve everybody else, and so I asked the question. So this woman, a picture up here, she was a planner who worked for me. I had the ideas, and she could write anything. So we got together, and during the time, across the country, we saw that most major cities were working on trying to serve frail elders regardless of their ethnicity. So we got in contact with them because we work for the city, we could do anything. So we actually started writing to people and calling them, and they were sending all the information. We said, still, nobody in any other cities were talking about African Americans. So she and I talked, and we started writing. And at the time, they had other programs. And I worked, sometimes I would write for the mayor. Sometimes if he's going to go to do a press conference on aging, he'll ask me, Margaret, would you come across and write? And I'll go to his office and I would write for him questions people might ask. So I had an inroad into him because we were in school together at UW. And so he told me one day, he said, send an email. He said, I want you to go to Washington, D.C. and speak to the U.S. Senate about what the West Coast is doing for aging Americans. So they sent Karen and me to Washington, D.C. And I spoke to the United States Senate and told them all about the things that was happening here and what we're going to do for blacks. I told them about the ACRS, Chinese Information Service, the Jewish American group population, and then I told them what we were trying to do in Seattle. It cemented it because when we came back, it was we were well received all across the country. And when I got back to City Council, asked me for the plan. We finished writing it up. They approved it, gave us money for it. The program was born. So Karen and I, we decided that we had we're going to go out and talk about this program. So the mayor had us send a letter out to all the African American churches in the area. At the time, some small, big, it was 123, I remember specifically. And we presented what we wanted to do. They said, well, you can only serve it's going to be about 50 people. So we're going to fund. Well, I was asked to do a report at the end of the year. We had almost 285 clients that were not receiving services from anybody. Nobody had gone to them to see if they needed it. And they were all at-home people, frail elders. Didn't know anything about anything. They didn't have the resources. So then we had to do a lot of educating for community people to let know these people A lot of them came here to the migration from the South for a better life. And they came in, but the ones who came were not educated people. They were just looking for jobs, like most other groups were doing. Mm-hmm. So here they are now. They've gotten frail at home and didn't know how to refer for anything. I had people that I had to teach how to write a check because if the husband would die, they didn't know if they owned the house because like the old school way of doing things. And so also we started talking to organizations to tell us about what their history was like working with frail elders. Mm-hmm. And a lot of people told us a lot of truths about how they did their work. And even the King County Medical Society, I used to go talk to them. They said, well, we did a study, we found that a lot of people, the reason they don't go to their doctors is because you don't respect them. You don't call them Mrs. or whatever you call them, Mayor or Jack. And some of these older folks, they don't like that. They feel like so they won't go back. So we start seeing clients after hadn't been to doctors in 30 years, 25 years. So physically they were broken down because they wouldn't go to the doctor. You ask why, because we had the health department was going out talking to these clients and said, well, no, somebody said to me, I know you have high blood pressure because all Black people have it. And so the older person, when they leave, they will never go back. We have some colleagues out there in the field at Swedish, for me, they'll do it for me. My own physician, we do, she's a Swedish. And I just met her in 2018 when CCS changed its provider, because we had grouped up before. And we had this, Stephen had bought this trainer here, and I didn't pay too much attention to it. We looked in, I said, this woman is taking patients, new patients, and so Kim signed me up on that. She was helping me. It was Dr. Rubenstein. And when I went to see her, I said, I know you. She said, I know you. Stephen had invited her to do training once, twice a year. She gets a new geriatrics fellows. And she's responsible for Swedish Hospital for these, and so we staff cases with them. We host Swedish Hospital interns and residents once a month. So Peter Zell signed it up for me, but they asked me years ago, and since Peter was our boss at the time, the Swedish Hospital asked us will we host and be a training companion for interns and new doctors, and so we do that. They come here once a month, and before COVID, they would go out in the field with my team, and they would come and go up with the staff. And they start with me, and we talk about it. We prepare a package for them and tell them who we are and those kind of things we do, and look at our paperwork to see if they can tweak it. If it need tweaking, give us an idea about it. And it's been wonderful because it's been 6 years now that the doctors that come to all different nationalities, and I love that because we learn from it. I learned from it. They come in here and they want to do community medicine, and they want to do it for older people. And so this past year, now they're going to other agencies, but we're still on the list once a month. And it's a great thing because we tell who we are, and they tell us what their specialist is going to be. And it reminds me because my grandson was one of them. He's a doctor up at University of Washington.
You've been called to bring your passion and expertise to outside boards like the Puget Sound Healthcare Alliance and the community advisors of the University of Washington's Health Promotion Research Center. Here's how George Dix, your colleague at HPRC, describes you, his friend and mentor. Margaret is a warrior for social justice and a relentless advocate for the whole community while recognizing factors that disproportionately impact African American elders. She's been a tireless and concise voice for bringing resources to the community, particularly when it comes to well-being of older adults. She was raised to strive for excellence, he said, and I see her doing that in all her efforts. Her dedication to community is not just a job by any means. It's a lifelong calling.
I've had wonderful experience with Irene and Michael. They've just been so good to me in terms of letting me do whatever I decided to do. They really have. The work that I've done, I'm very proud of it. And I love to talk about it.